As seen during Professor Bacher's lectures, nuclear medicine uses radioactive material inside the body to see how organs or tissue are functioning, imaging, or to target and destroy damaged or diseased organs or tissue. Naturally, there are certain risks involved. Using radionuclides. The potential risks not only affect the patients, but also pose a threat to the staff. Welcome everyone to Staff Radiation Exposure in Nuclear Medicine. In general, we can say that the amount of radiation dose obtainable from a nuclear imaging procedure is comparable to or often less than that from a conventional diagnostic X-rays examination. Generally, protection of nuclear medicine personnel from radiation hazards depends mainly on time, distance, and shielding. But let's go into the specifics. In the next few slides I'll be showing you the most important clinical settings and protection measures. Let's start with hot labs, or in other words the radiopharmacy department of a hospital, where we have the delivery, storage, and preparation of radioactive materials. This is the place where a multi-dose vial gets distributed into syringes with individual doses. Recent studies show the majority of absorbed dose is observed in the staff working in the hot labs. As you can expect, the fingers will get the highest dose. Because of this, it's useful to not only wear a body badge dosimeter but also a ring dosimeter to measure this maximum dose. Electronic personal dosimeters can also be used as a constant reminder of exposure. Of course, it's also important to put the vials in lead pots and to use syringe shields when preparing the syringes. Something that isn't to be underestimated is the distance law. As you all know, the dose decreases when the distance from the source increases. Therefore, it's very important to use tweezers while handling radioactive vials. It's also why when dealing with a high workload, it's best to handle the vials and syringes remotely. Recent studies found that using automated dispensing can significantly reduce the dose rate at the position of the operator. Use of syringe shields has been shown to give a substantial reduction in doses to the fingers. Note that we also see syringe shields seem to protect the staff less during dispensary. This is simply because at the time the syringe was unshielded during dose measurement. As seen in Form the data, the real importance of the protection syringe shields yield is during injection. For other protection in the injection area, it's still useful to wear a ring and full body dosimeter, and it's recommended to use lead-lined gloves. It turns out a ring dosimeter is useful for nuclear medicine staff doing all types of tasks. So why not use an eye lens dosimeter placed between the eyes? Well, research suggests the eye dose can in good approximation be derived from the full body dosimeter. Just like automated dispensing, recent studies also found that using automated injection can significantly reduce the dose rate at the position of the operator. After the injection, the patient becomes a source of radiation. That's why in the imaging room the technician must keep his distance from the patient and must spend as little time as possible with the patient. We should also take the patient's breath into account. For radionuclides in gas form like radioxenon, the room can get filled with airborne radionuclides, which the technician will breathe. That's why it's important to ventilate the room and have the technician wear a mouthpiece and nose clip. It can also be useful to have a mobile lead wall. Training and education. Let's also briefly talk about the importance of personnel qualifications, training, and experience in dose optimization and radiation safety culture. As scientific studies have pointed out, having well-trained personnel who understand the proper handling of radioactive materials is crucial for achieving a smooth work process and minimizing dose. To reduce the extremity dose, it's recommended practical continuing education of nuclear medicine staff. In fact, studies found that dose can be minimized by staff instruction and training to maximize the distance between themselves and the hot patients. Studies also suggested that workers should gain experience and improve their skills in handling radioactive material by practicing with non-radioactive materials. Finally, it's also important to have a rotating workforce, as this can help to keep doses low. In conclusion, proper radiation protection measures are essential for nuclear medicine personnel working in hot labs, injection areas, and imaging rooms. The use of dosimeters, lead pots, syringe shields, and automated dispensing and injection systems can significantly reduce radiation dose. It is also important to maintain distance from the patient, wear protective gear, and ventilate the imaging room. Training, education, and experience are also crucial for achieving a smooth work process and minimizing dose. By implementing these measures and promoting a strong radiation safety culture, we can ensure the health and safety of both patients and nuclear medicine personnel. Thank you for watching this video. Please note that none of this would have been possible without the following scientific sources.